I'm pleased to introduce Peter Travitsky, a supervising attorney at New York Legal Assistance Group. Welcome, Peter. I turn it over to you.
Thank you, Jeff. Hi, everybody. So we only have an hour together, so I'm just going to launch right into it. But I know my bio is posted, I believe, so I'm just going to skip all that. But I've been doing this for about a decade. Home care is near and dear to my heart. This is a pretty big topic. So home care is a pretty big topic. Um, we're not going to get through everything in an hour. So just like this is really a broad overview. Do not let this be the only training that you attend on this subject, uh, because you will probably get a lot from all of them. Also, there's a lot of vocabulary in this. So just to get started, first off, I am at New York Legal Assistance Group. I supervise our ICANN team. ICANN is the Independent Consumer Advocacy Network. And I'm gonna, next slide, I'm gonna talk a little bit about ICANN. I'm going to talk a little bit about long-term care. Then I am going to talk to you about MLTC, how you join MLTC, and how you can get help from ICANN. In the second slide deck, the one that you just saw a sneak peek of, I'm gonna drill down a little bit more on Medicaid eligibility, very briefly, and the types of home care that the New York State Medicaid program offers. And I am going to also just go off camera because I have two monitors and it's a little distracting. So first off, what is ICANN? ICANN is the Independent Consumer Advocacy Network. Key there is the word network. It's a statewide network of organizations. We're an ombuds program for folks who need Medicaid, I'm sorry, folks with Medicaid who need long-term or behavioral health services. We assist New Yorkers with the whole process, really, understanding how to enroll in Medicaid and also use managed care plans that cover long-term care or behavioral health services. And the reason it's important to understand managed care, which is just a basic term for health insurance company that has a relationship with the state. Um, the reason it's important to understand managed care for this is that about 10 years ago, a little bit more than that, I think 2011, 2012, the state mandated that folks who need home care, or most of them, not everybody that needs home care, but most folks who need home care, do so or access it rather through managed care rather than getting it from a local agency that is directly funded by the state. So instead, to get your home care, an insurance company acts as this middleman to oversee your home care services. What does ICANN do? Pretty much a lot of stuff. We answer questions, we give advice, we help people enroll in managed care, we help people solve problems that they're having with their plan. We help people understand their rights. We help file complaints with the plan and also with the Department of Health. I submitted like 4 since January. Um, and we also help with appeals when a plan denies services or denies an increase in services or tries to reduce services. So we help anybody who is enrolled in a managed care plan or is trying to enroll in a plan. I think this slide is a little bit misstated, but people who need long-term care and behavioral health. Long-term care is a catch-all term. I assume it needs no introduction, but just for the sake of specificity, we're mostly talking about home care, thus the title. But it also includes adult daycare and it can include nursing home. And sometimes, nursing home and home care kind of, I don't want to say merge into each other, but uh, people end up having the need to go into a hospital or into a short-term inpatient rehab facility, and then they need to come out. Like it's a continuum of long-term care. Uh, okay, and then we help people who are newly. I did say this. I'm sorry. We help folks who are newly eligible for Medicaid to enroll in a managed care plan for purposes of accessing services. And we will talk to whoever you want us to talk to, friends, family, social workers. We talk to providers, and really anybody who's helping you with your healthcare decisions. So if you're attending this training today, for instance, because you're curious about a neighbor you're concerned about, and you have some questions for that neighbor, we'll talk to you about that neighbor. But we can't really do much by way of appeal without having that neighbor's written permission. But advice is not something that we need written permission to give. We're not acting on your behalf. I said we are a network. We're statewide. Um, New York Legal Assistance Group is one of really a small army of organizations around the state that is over or led, I should say, by Community Service Society, also based in New York City. There's a few New York City agencies actually, and we all man the hotline for the ICANN program. But if you're attending this from Northern or Western New York, we've got you covered. There's a bunch of other organizations across the state. Um, but this is probably a good time to just clarify for folks that we are only talking about New York State today. Medicaid is a very large program administered between the federal government and the state. So every state's Medicaid rules are going to be a little different. Some of them, there are some similarities, but by and large, if you're here on behalf of somebody in New Jersey who lives in New Jersey, they'll have different rules. Um, we really are only talking about New York today. But within New York, all the rules are the same. So if you talk to an advocate in Albany for somebody who's in New York City, the rules shouldn't be any different. The person in Albany might be less familiar with local practices in New York City, but the overarching Medicaid rules are the same. So, like I said, we have a hotline. It has regular business hours, Monday to Friday. We're confidential. We can accommodate non-English languages. Um, we'll meet folks in person. We do home visits if needed. We phone calls, emails, texts, um, Skype. We give presentations like this one to consumers, to caregivers. I've talked to support groups, caregiver support groups, professionals. We love talking to doctors and social workers. Um, if you're here representing another group and you'd be interested in having us speak to you, please feel free to reach out. We'd be happy to talk to folks and get the word out about this. We also monitor our cases for potential trends um, to to report them to the state. We actually meet with the Department of Health like quarterly, actually. Um, and every now and then we do see a trend across managed care plans. Okay, so now with that long introduction, I'm going to talk a little bit more specifically about the subject you came to hear about. Okay, so Medicaid uh, pays for long-term care. There are really only three options for paying for long-term care: private pay, long-term care insurance, and the Medicaid program. I forget the actual statistic. I think it's something like 2/3 of the nursing home costs in the country are paid for through the Medicaid program. Um, that not just New York. Just to give you an idea of how much financial heavy lifting this program does. New York is no different, right? We the I think the cost of living in New York City especially is really high, but that doesn't mean that the people that live there are any less likely to be on Medicaid. Um, Most people with Medicaid, as I said, need to get long-term care through a managed care plan. Um, and as you'll see, there's a couple of different plan options, and it gets a little dicey because you might see the same insurance company offering several different plan options within those types. Um, but the rules for home care under the Medicaid program are going to be the same regardless of which plan type you are in, as long as it is a Medicaid managed care plan. Okay, so that it helps to just approach this subject with that kind of clarity that it really shouldn't matter as long as you're in a Medicaid managed care plan, a managed care plan doing Medicaid, not Medicare, not Medicare, but Medicaid. The home care rules are the same. Um, Okay, so and then the way it works when you're in one of these insurance plans is the state Medicaid program will pay the company to provide services to the plan's members. This is what I meant before when I said that the insurance company acts as a middleman. The state pays the insurance company provides the home care services. Whereas like 15 years ago, the state would have paid the home would have paid the home care provider directly. There is a question in the chat about income or financial eligibility requirements. We will get to that. Yes, there are some. Okay, so one thing when you're dealing with this subject, you'll hear MLTC referred to as uh, a universe of plan options. A lot of presenters will do that, but it's actually a specific plan type also. Um, and there are different types of, so on this slide, we're actually talking about MLTC, Managed Long-Term Care, as a universe of plan types. But again, all of them will cover the same long-term services. They all must follow the same rules, including for home care. Um, the different types of plan may cover different services, and you'll see what I mean in a second. But um, all of the plans within the same type have to cover the same services. So for instance, if you go to the next slide, um, these are the types of plans that the ICANN program will deal with. I'll tell you the top two are MLTC, the first one, and Medicaid Advantage Plus, the third one. The rest we've seen, but they're a little less common. So let's just say there's like in New York City, where insurance companies love New York City. We have a lot of people that live here. Um, there might be a dozen insurance companies that offer MLTC options. And not to pick on anybody, but one big one is Health First. Okay, Health First has an MLTC plan called Senior Health Partners. They also offer a Medicaid Advantage Plus plan called Health First Complete Care. They also offer a mainstream managed care plan. That's the fifth one down, and a HARP plan. That's the last one. Um, who can enroll in those? It really depends on a number of factors. But um, another one I'll say, let's just say visiting nurse service. They probably also need no introduction because they've had a footprint in New York for quite a long time. But they have an MLTC plan and they also have a Medicaid Advantage Plus plan. If you are in Health First, let's go with Medicaid Advantage Plus, and your your next door neighbor is in Health First Medicaid Advantage Plus, the actual brand shouldn't dictate anything other than like the plan type, the fact that you're both in Medicaid Advantage Plus products, you should have access to the same menu of services. So it is helpful. It's always helpful to understand what type of plan you enroll in. So first off, we're mostly talking about folks with Medicare today, in addition to Medicaid, but every now and then we'll get somebody who is not on Medicare, um, and these folks, by and large, are already going to be in a Medicaid managed care plan. Okay. Uh, these people would need to contact, well, they have to go through something called the New York Independent Assessor Program. But they would not have to go through an additional step of enrolling in a plan since they're already in a plan. But if you are somebody who is on Medicare and you apply for Medicaid, you become what's called a dual eligible for both. You have both Medicare and Medicaid. You would then need to be assessed by the New York Independent Assessor, which I promise you is coming up, and then pick a plan to enroll in. And that plan would then give you your services. So somebody on Medicare is going to be an adult who is disabled or an older adult from 65 and over. So that's just statistically, that's just the larger population of home care recipients. So we actually we end up making it a little bit harder, horrifyingly, but still a little bit harder for the population most in need to access the services right at the point of enrollment. That's just my own editorializing. Sorry. So now this is the full process. First step is applying for Medicaid. I have more on that in the second slide deck, so hang on. I'm going to start here by talking about the independent assessor program, which is step 2. As I said, you get Medicare, you get Medicaid, and you want home care. The first step is the New York Independent Assessor Program. And then I'm not going to really talk much today about type of plan, choosing your plan, or enrolling, because those can be a little bit more personal and fact specific. If you are up to that step, there's still stuff for you to learn today, but I would absolutely encourage you to reach out to the ICANN program for further advice. And if we have time, I'm obviously happy to answer questions here. Okay, so before we go to the next slide, I just want to set the table a little bit on the New York Independent Assessor Program. Medicaid, I think, frightens people because it's the subject of debate right now in the news. There are financial eligibility criteria. It feels like it has its own vocabulary. I want you to put all of that out of your mind and remember that we're just really talking about insurance, okay? When and health insurance, again, has its own vocabulary, but one thing that a lot of health insurance has in common is prior approval processes. And what I mean by that is you have to contact your insurance company to get approval first, right? Prior approval or prior authorization is another term you might see. You have to get approval before you do something, right? Or your doctor has, you may be insulated from that, right? Your doctor may be doing all of that behind the scenes, which thank God, but they they can't move forward unless they know if they have to bill you and how much, right? This is basically what the New York Independent Assessor Program is doing in the home care process. So you apply for Medicaid, you get Medicaid, congratulations, you have the insurance. Now you're trying to get a service from that insurance, just like getting prior approval for an outpatient surgery or an exploratory surgery or anything like that. The next step is to get right. The way you get permission is through the New York Independent Assessor Program in order to proceed to get home care. Okay. So with that table setting, what is the New York Independent Assessor Program? Next slide. The New York Independent Assessor Program is a contractor of the state that is set up specifically to figure out if you qualify for home care. They have their own phone number with really lovely hours. I'm sorry, I'm sorry, I'm skipping ahead. So it's a company that works for Medicaid. They assess people to find out if you're eligible for home care and to enroll in a plan. You cannot get into an MLTC or a Medicaid Advantage Plus plan, which I said before, these are the most common that people choose, unless you go through the independent assessor first. Another plan option, PACE, which I haven't talked about, but PACE, you don't need to go through the independent assessor program. But in New York City, at least, there's only one or two that serve the whole city. So we tend to see these cases less. Another thing about PACE that's unusual is the model of service delivery is such that you have to get all your services from a single PACE center. And they'll take you to the center, but it may not be like down the block. Again, there's only one or two that serve New York City. But certainly enrolling in one does allow you to skip the independent assessor program process. That's not an endorsement, it's just the way they set up the system. So as I was saying before, they have lovely hours. The independent assessor is, they've got evening hours and they've got Saturday hours. When you call them to set up your appointment, they're actually setting up two appointments for you. You can do them in person. Telehealth is also an option and it's faster. I don't really have an opinion about what's better, but certainly in person is a little bit more practical for many folks. It's very hard to see what level of impairment somebody has to justify their needing home care over a FaceTime window or a Zoom window on a cell phone. But it's broken down into two appointments. The first one is called the community health assessment. And it's pretty long if it's done correctly. We have to review these all the time, and the final assessment document is going to be 20 to 25 pages. And it's all the same. It's a standardized interviewing instrument where they ask about your medical condition, what you need help with, and they focus on the tasks that you need help with, which we're going to talk about in the next slide deck. Um, and like I said, it's a standardized list of questions, so there are certain things that don't appear that you may want to make sure you bring up. For instance, there are no questions about whether you have a need for overnight care, and that's something you would definitely want to talk about. Also, every managed care plan has to use the same document when approving services. This document does not say how many hours of home care you will get, but it is a document that has to be consulted for the approval. Okay, the next part is the clinical appointment. This is by a doctor, shorter list of questions, and they're basically only looking to see if you have a medical condition that will not suddenly deteriorate, in other words, that you're medically stable, and that you have the ability to direct your care or that you have somebody else who is willing to do it for you. And then finally, you will get an outcome notice a few days after, and it'll tell you whether or not you're approved for MLTC enrollment and if you have a stable medical condition. Next slide. The outcome notice, um, I'll say more about this, but it never says yes. It only says maybe or no. I will say we get a lot of inquiries about these because they are so simply written that it is very deceptive, or it can be. And so people aren't always sure what they mean, is what I mean to say there. You have the right to appeal. You can request a fair hearing if you don't agree with the decision. And then if the judge agrees, they can make the independent assessor change the decision. I generally don't often advise for a fair hearing. I think it can be quicker to try to just get them to reassess you. But fair hearings are an option. Okay, so like I said, I'm not going to really spend much time on this at all, but once you've gone through the independent assessor, assuming you've been approved, you can pick a plan, and you basically have to shop for a plan. Uh, ICANN and New York Medicaid Choice can both have conversations with you about this, but you actually have to shop for a plan. You have to go to the plans and ask them to then assess you, and they will give you an offer of services and hours. And if you like them, you sign on the dotted line. They submit enrollment paperwork to New York Medicaid Choice uh, to get you enrolled in a plan. New York Medicaid Choice, their whole job is to process enrollments and disenrollments in managed care. So you really don't deal with them much at all throughout this process, except for the point of enrollment. And even then, the plan is responsible for submitting the paperwork. But they can talk to you about plan options. Next slide. Enrollments have to happen by the 20th of the month to start services the first of the following month. So if you say on April 21st that you know which plan you're going to enroll in and you sign up with them, you are not starting services until June, right? That 20th it's an important deadline to keep in mind. So the entire process, if you're applying from scratch for Medicaid, um, can take several months to get it right. Okay, and now the ICANN hotline is here. You will have access to these slides. We also have an email address. Um, I'll also say once you're in a plan and you start getting notices from the plan, especially notices denying services or reducing services or responding to a complaint that you made to the plan, the ICANN contact information will be in the notice. It is mandated to be in those notices. Okay, and that is it for the ICANN slides. I am taking off my ICANN hat and I'm going to talk to you now as a NYLAG advocate. So first, NYLAG is, sorry, next slide. NYLAG is a nonprofit civil legal services uh, law firm. We have several civil legal services only. We don't have a criminal law practice, but civil legal services is a very broad area. We've got an immigration team. We've got a whole contingent of healthcare advocates. We have financial counselors. There's a housing team. It's many, many services. I am in the Evelyn Frank Legal Resources program at NYLAG. That's where our ICANN team is housed. And we focus on advocating for older adults, adults with disabilities in the healthcare and home care space. And with a focus, well, I'm sorry, we have like a four-pronged approach. We counsel people, we train, we do a lot of trainings, just like this one, to professionals, to consumers, their loved ones. We assist people who are trying to access home care services through managed long-term care plans, and we represent people in appeals. We our work also goes, I mean, not to put too fine a point on it, but our work is beyond home care. We also work in Medicaid, access to Medicaid and the Medicare Savings Program. I just want to plug right now that even though the public health emergency for COVID-19 ended, gosh, 2 years ago now, um, New York State is still winding down its a series of protections that were in place to prevent people from losing Medicaid coverage during the public health emergency. And these were federal, like this was across the country. Um, New York has a very big program though, so it's been pretty difficult. And I say that because I think many people who've already had Medicaid may have sort of forgotten that they have to renew. And many people are renewing for the first time. Um, and so now is the time. If you get a renewal in the mail, if you get a package from your local Department of Social Services in New York City, that is the Human Resources Administration, you absolutely need to return that packet with your information if you want to keep your Medicaid. Um, if you have never done it before, or you have and you just want some advice, please do reach out to us. In addition to all of what I just said, we have a a policy advocacy website where we put like everything we can about the Medicaid program as things develop, as things evolve. There's also a lot of consumer-facing materials. It's a pretty expansive website. We get hundreds of thousands of hits a year, um, maybe even a million. Right now, a really hot topic is a lawsuit that's happening with respect to changes in the consumer-directed personal assistance program. But there's a lot of stuff on there. And sometimes when you reach out to us, we may even just say to you, you know, the answer to your question is in this fact sheet that's on our website, and we'll give you the link, or we'll give you an address to an article on the website um, for you to read. It's it's a labor of love. We are not funded to do this. It's just that there's so much information uh, to 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 get out there. So this slide is a copy of the previous slide deck because I just wanted to orient you to what I'm talking about here. I'm mostly talking to you a little bit more about applying for Medicaid and the independent assessor program. 2 slides. So big picture, we're talking about home care, but people apply for Medicaid for other reasons. It may be your only health insurance. It may reduce or eliminate your Medicare deductible and copays. Certainly also, this is less common, but we also see people who have other third-party health insurance besides Medicare, um, or rather they don't have Medicare, but they have some other private insurance. And they can't afford it. So Medicaid may wrap around that insurance to help with the cost sharing. It may also provide services that are not covered by Medicare or other health insurance. And some common ones on the right side of your screen. Um, with apologies, I couldn't really find a good graphic for this, but the taxi cab with the calendar thumbtack, that's supposed to be non-emergency medical transportation. I know it wasn't very good. But appointments, right? Not ambulance service when you have a health crisis, but medical appointments. This is going to be ambulette. Sometimes it'll be a car service. But when you know the appointment is coming and you schedule transportation, Medicaid can pay for that. Audiology, dental, um, optometry, eyeglasses, and then the last picture is supposed to be home care and visiting medical services. But some of these are covered through Medicare Advantage plans, but the coverage is not as it's usually not as robust as Medicaid. Medicaid is really there as a safety net program of sorts in that it folds in everything. It is just more expansive. It is built to be more expansive in New York. Not every state, again. New York has a pretty robust Medicaid program. Next slide. There was a question before about financial criteria. Um, First off, if you have, I'm not going to have time to answer everybody's questions about financial limits today. We can, Jeff, we can talk about maybe scheduling another webinar to talk about that because it really is its own topic. But if you are interested in screening for Medicaid or have questions, New York is a great place to get advice that is sanctioned by well, that, or at least that is can be considered reasonably expert. We have facilitated enrollers. These are funded through the state to help people with insurance questions about, or rather Medicaid questions. High cap counselors, New York Connects, which I believe specifically is for long-term care. I'm not sure though. Private attorneys, if you're sitting on a net, a pretty small fortune, or rather, pretty small fortune, a fortune, or you're looking at the numbers on the right side of the screen and it's making you sweat a little bit, you might want to think about planning by speaking to a private attorney. They have a lot of strategies for protecting people's estates. And then, of course, geriatric care managers. These are private care managers that you pay, and there's a lot of expertise there too. But big picture, the income limits and asset limits in New York State, thanks to a change in state law 2 years ago, are more generous than they once were. Now, in 2025, for a single individual, the limit is $1,800 a month with an asset limit of $32,000. If you're talking about a married couple living together, then the income limit for the couple is $2,443 and an asset limit of $43,000. The Medicaid calculation, the budget calculation, also factors in a $20 disregard. So you have to add $20 to those numbers. So it's actually $1,820 a month for a single individual, $2,463 for a couple. If you're over that limit, you might be subject to, yes, it includes Social Security. Somebody put that in the chat. Income is any money that you get, any. If your loved one gives you money, it is income. It counts against you for this limit. If your loved one pays for a bill on your behalf, that does not count as income for this program. So, if they're subsidizing your rent, see if your landlord will accept a partial payment from the loved one, or maybe they could put the cost to, or the payment toward your utilities or cable, something other than directly in your name. So a spend down is the difference between your income and the Medicaid limit. It has to be met every single month. So let's just say your income is, let's say you're a single individual and your income is 2320. And I chose that number because it's a very nice round number. The income limit is 1,800 plus a $20 disregard. That's 1,820. The difference between 2320 and 1,820 is $500. So you would have a $500 spend down. This is very basic. If we were to do a full training on this, I would give you more of a diagram for this, but I just want you to keep that number $500 in mind. You are $500 over the income limit for Medicaid. Does that mean they're going to turn you away? No. What it means is you are going to be on the hook for the first $500 of your Medicaid coverage. So if you have no insurance, but you are disabled and you have Medicare, I'm sorry, Medicaid. You're disabled, you have Medicaid, but no other insurance, and you are $500 over the limit, and your doctor were to bill you $600, you would pay the first $5 and Medicaid would pay the $100 remaining. That's the basics of what a spend down is. There are a lot of ways to reduce that cost, a lot of them. Um, and I should also say in the home care context, when you have a spend down, so again, the same $500, uh, it's too administratively difficult to have you pay the Medicaid program $100 every single month. I'm sorry, pay $500 every single month just to offset the cost of your home care by $100. So when you have home care, you pay the home care provider directly the $500. So either way, whether you owe the doctor or you owe your home care provider, you now have this $500 bill. And a lot of what a Medicaid financial eligibility training would be is discussion of how to get rid of that cost. And there are ways to do it. Totally legal, there's nothing crazy sounding here. Like it's all above board. And actually, this article that I've linked goes through several of them. There are options for married couples. There are options. I mean, you may have, if this isn't your first training, you may have heard of something called a pooled income trust. There's a variety of ways to avoid the cost of a spend down. Okay, next slide. The independent assessor program, like I said before, it doesn't say yes, it says maybe or no. It'll have language like you may qualify to enroll. I'm sorry, the outcome. We're talking about the outcome notice. So you've applied for Medicaid. You are now trying to get prior approval for home care. So you call the New York Independent Assessor Program. They do a community health assessment. They do the clinical appointment. They send you an outcome notice. That was all stuff from the previous slide deck. Your outcome notice will say you may qualify to enroll in a plan. Your clinical exam shows your health condition is or isn't stable to get home care. You may be eligible for home care. You may qualify to receive other services. So this is what I meant by we get a lot of questions about this because these notices are so simple but deceptively so. Next slide. So like this is what a good outcome notice would look like. It actually has slightly more words, but the ones that matter are the ones that I've circled. Right? So this is what a notice would say that looks good. That's like you can go and enroll in a plan and get services. Your clinical exam shows your health condition is stable, and you may qualify to receive long-term services and supports through an MLTC plan. So this person is tentatively approved for enrollment by the independent assessor program. And I say tentatively because that may actually gives the plan an out. If they think that you're not eligible, they might choose not to enroll you. But that's okay because there are many other plans that you can contact. If you find a plan that wants to bring you on board with them, they have to consult the community health assessment that the independent assessor did. That's that 20 to 25 page assessment. The plan makes the actual determination of how many hours you'll get. They may tell you that the community health assessment bound their arms, but that's not true. The plan makes the determination. The community health assessment is really just discussion of what your functional needs are. 2 slides forward. Okay, so we're nearing the end. This is the last stretch. So if you have questions that I haven't gotten to that you wanted me to address, please do put them in the chat. But there are 4 basic types of home care. Well, there's only 4 types of home care to know about under the Medicaid program. And the first one is personal care services. By and large, this is like the number one. This is the one that most people have. There are 2 types, and the home care regulations actually distinguish them as level 1 and level 2. Level one is housekeeping. This is what it sounds like, chore services, shopping, cooking, cleaning, laundry. This, if you only need housekeeping, this is going to be capped at 8 hours per week. Um, that's it. 8 hours a week for housekeeping. To the person asking if we're going to get a copy of the slides, yes. The second level, level two, this is the one where most of the action is. This is what are called activities of daily living. I'll talk about those in a second, but um, you can get up to 24-hour care um, through personal care, really actually any of the home care types that I'm going to be talking about. But um, the ceiling for personal care is that the aide cannot do what's called skilled care. There is a scope of tasks document that has not been updated in 30 years. There's a link to it. And it has some surprises on there, but mostly it's just going to be the ADL tasks that we'll talk about in a second. One important limitation is that the patient must be self-directing or have someone to direct care. So, somebody that has advanced dementia hopefully has a loved one or a really lovely neighbor or friend who is willing to step in and be an active participant. But directing somebody's care doesn't mean you have to live with them. It just means that if the aide needs to reach you for instructions, she can. You have to have, I believe the guidance says that you have to have substantial daily contact, but you know, that's pretty broad language. Actually, I have one client whose daughter manages care from, I think, Philadelphia. But she's in a different type of home care. So anyway, um, another limitation is that the aide cannot be related to you. Um, uh, okay. This is there's an important contrast here to consumer-directed personal assistance, which I'll talk about at the very end. But skipping to the tasks, personal care is bathing, dressing, grooming, toileting, transferring. Transferring is standing up, sitting down, walking or ambulation if somebody can't walk, maybe they're in a wheelchair. Same idea, just locomoting, right? Meal preparation, eating, like physically feeding the person. Medication reminders, setup of medication, and routine skincare. Medication reminding is different from the patient needs a pill put in her mouth, or the patient needs medication crushed into applesauce, or the patient needs an injectable medication. We're really just talking about reminding the patient to take their medication, and if they need some kind of mechanical manipulation so that they're in a position where they can take the meds. Um, Important point here, supervision is not a standalone task, okay? Meaning the tasks that matter are bathing, dressing, like the ones on the left. That's what you really want to focus on. And I think this is where a lot of folks get tripped up because it's very difficult to articulate what a loved one needs help with. There's a question in the chat whether if somebody has dementia can still get home care or do they insist on nursing home. Depends on the case. It depends on the facts of the case, but uh, dementia is the perfect example of where supervision comes up. And I'll just say that I've had so many clients at this point in my career. I don't think that, there are definitely people that need supervision as a standalone service, but I find that most folks are just not able to articulate what the need is, right? Um, if your mom needs help walking, but she wanders, well, if mom needs help walking, then that's really the issue, not that she wanders. But nobody focuses on that because the scary thing is the wandering. So it's really important to not react from fear. And this is the perfect example of a area where if you contact ICANN or NYLAG, we can talk you through what the actual needs are, or another advocate who, if you need to consult a private attorney or a geriatric care manager. But help exists on a spectrum. It's not just physical weight-bearing assistance. It can also be verbal cues and prompts. I'm sorry. I think I didn't. Next slide. I've been saying all this, and all of this, everything I just said is on this slide. Apologies. Next slide. The next one is certified home health agency. This is a step up from personal care. Um, and this is a little bit more intensive than personal care. I don't really have a ton to say about it, except that uh, the scope of tasks document for this, which there's a link to on the next slide. It's basically personal care, plus there's a little more that the home health aide can do here. The scope of tasks document, which there's a link on the bottom here, is like 75 pages long. So this is another one where you really want to talk to an advocate to get a sense of like what is needed for this patient. But for example, a lot of people don't, I've had a number of clients with diabetes at this point who um, really can't do a finger stick or check their blood sugar. And there are certain parts of that that a home health aide can do if the patient is self-directing. Personal care cannot. A personal care aide can't do that. Um, Home health aide is considered a higher skill. Of course, there's certain tasks where the home health aide may not want to do it, but there are uh, a number of tasks in the home health aide repertoire, or should be, um, that might be reimbursable by Medicaid that the person can qualify for in lieu of personal care. There's also private duty nursing. This is exactly what it sounds like. These are very medical tasks. Um, we're talking people who need tube feeding. They might need oxygen administration, um, suctioning of a tracheostomy. So this is like when somebody has a tracheostomy and they can't, um, there's a risk of aspiration of, not to get too graphic, but saliva, mucus, right? The things that our bodies do that we just sort of take advantage for, that we just sort of take for granted rather. Um, those processes don't stop when you are physically compromised. And if you have a medical apparatus that's helping you breathe, you don't want to inhale those secretions. So those things need to actually be suctioned by a nurse. Injections, administration of medication. And here, very important, you have to have a backup who is trained in all these skilled needs. And that actually has to be attested to by a physician. Hopefully, you never need this, but we certainly have had um, a number of these cases. It is vitally important that the backup be trained, because if the nurse can't show up for some reason, these are people that need to be in the hospital. Next and last slide. So please get your questions in the chat now. The last type of home care, and I save this for last because they can do the most, is the consumer-directed personal assistance program. And again, all of these Medicaid managed care plans have to provide these different types of home care if they are medically necessary. It's the same as personal care, plus they can do all of the skilled tasks that I just mentioned. Uh, the aides are paid by a fiscal intermediary. New York State recently changed the law on this. So now there's one fiscal intermediary called Public Partnerships, LLC, but all of the plans have to contract with them. Um, and now here, unlike personal care services, the CDPAP aid also, you may also see CDPAS, where the S is services instead of P for program. It's the same. But the aid can be any adult relative, as long as they are not your spouse or otherwise legally responsible for your care and support. They also can't be the person directing your care. And that is it. I'm at the hour. So if there are any burning questions um, that we couldn't get to today, you'll find our contact information at the very first slide. It's an email address. Thank you for tuning in. And Jeff, if you have any closing that you need to
Yes,
do.
thank you for joining us.